Squirrel Tribe, we need to have a serious conversation. So we talked a couple days ago, maybe a week ago, about what was going on with Medicaid. Well, today we need to discuss Medicare. A lot of y'all are either on Medicare or right on the cusp of being on Medicare or contemplating being on Medicare. So we need to discuss exactly what's going on now in 2025, thanks to what was signed into law in 2022 under the Joe Biden, Kamala Harris presidency, vice presidency regime, whatever, in the Inflation Reduction Act, the IRA of 2022. So these are the changes that are going to be occurring with Medicare starting this year. And you guys need to fully understand these things because these are very important. Now, a lot of people talked about Project 2025 during the whole election process between President Trump and Kamala Harris after Joe Biden had to drop out. There was a lot of talk about Project 2025 and how Project 2025 was going to come through and just wipe out Medicaid, wipe out Medicare, wipe out Social Security, all these different things. Well, that seems to be not something that is coming to fruition, thankfully for a lot of people, I'm sure. But there are some things that are occurring with Medicare that are important to know. And again, these went into law under the Biden-Harris administration. As far as I am aware and what I have been able to find here, nothing has changed under the Trump administration as of yet. Now, he does have that one big, beautiful bill that had some changes to Medicaid and things like that. I think it was $880 billion in cuts over the next 10 years to get rid of Medicaid being paid out to illegal immigrants or people who could work but just choose not to work. All those different things we talked about in that last video, right? Well, today for Medicare, these are things y'all need to fully understand, okay? So we're going to talk about them, and you may already know some of these you may not know, but this is stuff that whether you are of Medicare age or not, or whether you have it or not, it's still important to know because I know you know somebody who is either on Medicare or going to get on Medicare, and this could be very beneficial to them. You may hear something you need to share with them. So let's just jump into it, right? So we're going to talk first about Medicare Part D, which is the prescription drug and the reforms that are going on with it. Now, this is from, so y'all know where I'm getting my information. This is from aarp.org, this little section here that we're going to talk about. So right now, what is going to happen is there's going to be a $2,000 out-of-pocket cap. That's one of the big major changes is the introduction of a $2,000 annual cap on out-of-pocket costs for prescription drugs covered under Medicare Part D. This cap applies to both standalone Part D plans and Medicare Advantage plans with prescription drug coverage, the MAPDs. Once beneficiaries reach this limit, they pay $0 for covered drugs for the rest of the year. So if you reach your $2,000 limit by March, you have zero copay or zero out of pocket for the rest of the year, right? If it takes you all the way up until December and you don't hit that $2,000 out of pocket, well, then you don't have any zeros, right? You're still paying until whatever. But according to this, once the this is expected to save approximately 3.2 million beneficiaries an average of $1,500, with some saving up to $3,000 or more, particularly those with high-cost medications for conditions like cancer or multiple sclerosis or anything else that has these high-dollar prescriptions attached to it. $2,000, especially if you happen to be on a fixed income. Let's say you're on Social Security. Let's say you're retired, all these different things. It is definitely harder to reach that $2,000 out of pocket, but thankfully it will now be capped at $2,000. You're not going to have to pay over that for your prescription drugs. All right. Now, this one, I've heard a lot of people mention the donut hole, and I didn't understand exactly what it was. Here, it's a restaurant, the donut hole. When it comes to Medicare, something completely different. Now, this one, I got the information from MedicareResources.org, so you guys know. This is the elimination of the donut hole. So the coverage gap, or donut hole is what they called it, in Part D, which is still the prescription one, has been eliminated. Previously, beneficiaries paid 25% of drug costs in this gap after $5,030 in total drug spending in 2024 until reaching catastrophic coverage. Now, after meeting a plan's deductible, which is up to $590 in 2025 this year, beneficiaries pay 25% co-insurance until they hit the $2,000 cap, which is basically simplifying cost sharing. So it's supposed to make it easier all the way up to that $2,000. And then once you hit that $2,000, even easier after that, right? Now, this one, the Medicare Prescription Payment Plan, the MPPP, this is from aarp.org also. This optional program allows beneficiaries to spread out-of-pocket drug costs over the year in monthly payments instead of paying large sums at the pharmacy. This is particularly helpful for those with high drug costs early in the year, though it doesn't reduce total costs, just FYI. Beneficiaries can enroll at any time by contacting their Part D plan. Now, that's another reason why I want to mention this to you, because I know you guys have heard me talk about it before, and I will talk about it till I'm blue in the face, until y'all have memorized the phone number. But if you guys want free help, literal free help with your Medicare, this is who you need to call. You need to call Chapter at 513-898-3528, because they will help you understand what is going on with your plans. Part A, B, C, and D. They'll help you figure out if you're on the correct part or not, if there's tweaks that can be made to get you into a better one. Because a lot of people don't realize that you don't have to wait till that October through December open window. I think it's October 15th through December 7th, if I remember correctly. You don't have to wait for that window. If you have moved, you can call and they can help you figure out if there's changes you can make, because there are certain reasons behind why you're able to change your Part A, B, C, or D of your Medicare plan outside of that October to December window. So it's always a good idea to call, whether you think you are able to change or not. They will be able to help you to know if you can. Also, you may think you're on the best plan. They will go through over 25,000 different plans to let you know if you're on the correct one or not. If you are, if everything looks absolutely hunky-dory and you have the cream of the crop, the best of the best, they're going to tell you, way to go, John or Pam. I'm just throwing out names because those are the two I thought of today. Way to go, John and Pam. Y'all have picked the correct ones. You guys are great. You have the best you can get. Great price, great coverage, great whatever. And then that's it. You say thanks for your help and you move along. But there's always a possibility that there's something they could change that could either save you money, right? That's always a plus. Or even if it's not saving you money, it gets you into better doctors, closer doctors, things like that. So please, it's a free phone call. It'll take anywhere from 30 seconds to an hour, depending on how deep you go into the conversation with the person you get on the other end of the line here in the United States of America. Side note, let's point that part out. That's very important to know. Again, call them 513-898-3528. Free phone call, could help you out. Okay. Now let's get back to the changes that have been made here with Medicare. So we are now at the premium and deductible increases. Again, these are reasons why you need to call Chapter to see if you're part of any of this and if you can fix any of this for yourselves, right? So this says Medicare Part B. The standard monthly premium for Part B, which is covering outpatient services, doctor visits, and preventative care, for I'm sure y'all know, but in case not, that's what it covers. It has increased by 6% to $185 in 2025, up from $174.70 in 2024. Not a massive increase, but what is that? $10.30 does start to add up over time for a lot of people, right? So if you can call Chapter and they can find ways that maybe possibly saves you that $10 somewhere else in your plans, that's even better. Anyway, it says the annual deductible rose to $257 from $240. These increases are attributed to projected price changes and higher utilization, because there's more people that will now be in Medicare, right? Now that's from cms.gov, so you guys know exactly where I got that information. Now for Medicare Part A, because A, obviously, everything here is going to have a little bit of a tweak somewhere. Now, the inpatient hospital deductible, unfortunately, increased to $1,676, which is up $44 from just last year, right? Co-insurance for days 61 through 90 of hospitalization is $419 per day, and lifetime reserve days are $838 per day. For skilled nursing facilities, co-insurance for days 21 through 100 is $209.50. Only about 1% of beneficiaries pay Part A premiums, which rose to $285 a month for those with insufficient work credits. So there's not a lot of people who are on this Part A. It says 1%. But still, for those of you who are or need to be or should be, this is important information to know. And again, this is from cms.gov as well. Now, Part D premiums, okay, the Part D base premium is $36.78. That in and of itself is a 6% increase from 2024. So in 2025, we're seeing a lot of increases in the cost of things, which is also, in my personal opinion, why President Trump is trying to go through and find these things. What DOGE was part of, Department of Government Efficiency, going through trying to find waste, trying to find all these different things, because maybe there will be a way in the future, fingers crossed, that they can then bring these prices back down if they're able to cut costs through Medicaid or wherever else. Maybe they can go through and bring the cost of Medicare back down for people on it. But according to this, A premium stabilization program limits monthly premium increases to $35 for 2025. However, some plans may raise deductibles or adjust formularies to offset the $2,000 caps cost. So I'm going to sound like a broken record, and it's only because I love y'all. If I didn't give a shit, we wouldn't be having this conversation, right? Like y'all understand how it works over here on SquirrelTribe. I don't tell you stuff unless it's important, right? At least to me, it's important, right? But the reason I keep pushing chapter at you guys is because it is free. And when it says here, where were we? Where did I read? Some plans may raise deductibles or adjust formularies to offset the $2,000 caps cost. You want to know if you're part of that some plans or not. Please make the phone call. Please make the phone call. It's free. You don't want to be part of some plans if there's a better plan for you that's not going to raise your costs, right? That's all it comes down to. I fully understand that being able to spend every dollar you have in the wisest way possible makes the most sense. So like when you're going out shopping, whether you're at Walmart, whether you're at Fred Meyer, whether you're at HEB, I think it's the other one on the You Never Eat, Try to Eat West Coast. You guys are shopping through and you're looking for the best deals. You want that BOGO at Publix, the buy one, get one free. You want that half off. You want those discounts. Please implement that everywhere in your life. Your Medicare is no different than that. If there's the way to save some money or to be on a better plan or to have something that's going to benefit you more than what you already have, please just make the phone call. It's free. All right. Anyway, let's get back to where we were. So this is, and I got that from aarp.org, just so you know. Now, this one is for your Medicare Advantage, the MA changes, which we've talked about a little bit, but we're going to go through it just a little bit more. This is from MedicareResources.org, and fewer plans and benefit adjustments. All right. The number of Medicare Advantage plans has decreased in 2025. So again, you need to know this. And some insurers are exiting markets or scaling back service areas. Certain plans have reduced supplemental benefits like over-the-counter allowances from 85% of plans in 2024 to only 72% in 2025. Transportation from 36% down to 29%. And meal benefits, 72% down to 65% to manage costs amid lower government payments. Now, again, keep in mind, this was during the Biden administration. This was implemented in 2022. And I'm not saying whether you are for Democrats, Republicans, whatever. I just want it to be noted where these changes came into play. All right. So this is from 2022 when the induction, that's not right. Y'all, the IRA in 2022, this Inflation Reduction Act. There we go. Brain, you can do your job. I promise. This is important to note. Okay. Now this one here, mid-year supplemental benefit notices starting in 2025. Now, MA plans must send mid-year notifications, meaning in July. So just a month and a half away, to enrollees about unused supplemental benefits, meaning your dental, your vision, or your hearing, including how to access them and associated costs. This aims to increase utilization of these benefits because a lot of times people forget what some of their benefits are, or you don't realize how long it's been since you had a hearing test, vision, whatever, and you or gone to the dentist. And so this is in theory meant to remind people, help people to go take care of those things before the year is up, right? Now, this one here, provider network changes. Important. In some regions like Minnesota, an estimated 60,000 beneficiaries may need to switch MA plans or providers because certain clinics and doctors are no longer in network. Beneficiaries are encouraged to review plans during open enrollment to ensure provider access. But why wait till open enrollment? Now, this is from mn.gov. It's from the Minnesota website, government website. But there's other places besides just Minnesota that are going to have these options or these issues where whatever you had is no longer considered in network. And you don't want to find that out when it's too late and you go to the doctor, you go wherever, and then you find out you're having to pay more because you're not in network anymore. And out of network prices are always freaking astronomical, no matter what kind of insurance you have, whether it's Medicare, whether it is your regular old Humana or United or Blue Cross Blue Shield, whatever it is, out of network, we try not to do that because it is always very expensive. So again, if you're not sure if you are going to be affected by in-network, out-of-network, make the free phone call chapter. The link is in the description of the video. The link is in the pinned comment of the video. I flashed it earlier. You guys can look back and see it. Like, just please pay attention there. Now this one, there are expanded benefits and coverage, which this first one is huge, especially given the how way the world has been the last couple years, I guess is how we'll phrase that. So mental health and caregiver support. So this is from mn.gov also, but Medicare has expanded coverage for mental health services, cardiovascular risk assessments, and dental care linked to Medicare covered treatments. A new program called GUIDE, GUIDE, supports people with dementia and their caregivers with care coordination and respite services. Good to know, right? And then there's an extra help program. This is from panfoundation.org is where I got this. The low income subsidy, or LIS, or extra help program was expanded in 2024. And now in 2025, those who qualify, meaning your income is below 150% of the federal poverty level, they pay no more than $12.15 for brand name drugs and $4.90 for generics. The partial subsidy program was eliminated, simplifying access to full benefits. So again, good information to know. And then here we have drug price negotiation. So in 2024, Medicare negotiated prices for 10 high-cost Part D drugs with reduced prices effective in 2026. So next year, right? Expected to save $1.5 billion in out-of-pocket costs in 2025 right now. An additional 15 Part D drugs will be selected for negotiation with prices effective in 2027. So these are things that you can look forward to. Made my nose itch. Unfortunately, those things aren't occurring right this second, but they are things that will happen next year and the year after. And if you happen to be on any of those drugs or need to be on any of those drugs, it's good to know exactly what's going on. And I got that from AARP.org also. Now, obviously, there's a lot of things that have been going on. Some of the challenges being the higher premiums and deductibles for your parts A, B, and D, along with reduced MA benefits and fewer plan options. But these are things that it's better to know it now than to be blindsided by it, whether you're already in Medicare or you're not, or trying to get on it, whatever. These are things that you should definitely know, right? The important thing is that you do your own research, right? I say it all the time. Listen to what I say, but also do your own research, that you reach out to whatever. Maybe you have an insurance broker. Maybe you have somebody that helps you. Reach out to them. If you don't want to reach out to Chapter, that's fine. It is free. Once again, I'm going to remind everybody it is free. Just like with a regular doctor, sometimes you want two opinions. If you happen to have somebody you've been working with, call them. See if what you're on is correct or if there's something that's better for you. Then call Chapter and see if it's comparable. See if they tell you the same thing or not. Because like we found out with the Medicaid a couple of days ago or a week ago, there are a lot of brokers out there who were getting a little extra pocket change from some insurance companies and some drug companies in order to push them a certain direction. Not saying that's what your people are doing, but it's always better to have a second opinion than to just take that first one without knowing if there's better options for you. So, and because I love y'all, the only reason I do this is because I give a shit. I have a mother who is on Medicare. I have a mother-in-law who is on Medicare. It won't be long before my ass is going to be on Medicare. You know what I mean? So these are things that I find very important. And if I can help anybody, whether it's you or it's your mom or your aunt or your grandparent or your neighbor, then I feel like today's, I had a purpose today. And so once again, I'm just going to show it to you guys if it's easier this way. Please, please, please. It's free. And if you don't want to call, there is the website. You can always go to askchapter.org/tribe and you can go that way, or you can call the phone number 513-898-3528, free phone call. After everything that we've talked about today, I'm sure there's something in your mind going, I wonder if this is the best option with what I've got, or if there's some tweaks that can be made. Call. With all the things that are changing, it never hurts to call. So that is it. That's the information that I have right now for y'all for Medicare in 2025 with what's going on. If there's any changes that come about, whether because of something that President Trump puts in place with that one big beautiful bill or anything that's coming forward, I will of course let y'all know. But for right now, that is kind of everything wrapped up with a nice pretty bow to give you an idea of all the changes that are happening right now in 2025 with Medicare Part A, B, C, and D. That's all. I love y'all immensely. Have a fabulous day. Goodbye.